I am fortunate that I have worked with Makan since he arrived at the Sacramento Zoo. He was still a youngster. He was 8 years old, which is around the time that a wild orangutan would leave his mother. We noticed something was different about Makan, and it's very commonly seen in orangutans. But we knew from that young age when he came here, we were going to have to prepare him for a lifetime of dealing with his chronic illness.
There's a disease condition called Orangutan Respiratory Disease Syndrome. It's similar to what humans might call cystic fibrosis. So it causes a lot of respiratory disease symptoms in our affected orangutan. In order to manage this health condition, he often needs regular exams to check in on his respiratory status. We also need to monitor his heart health and ensure that also is appropriately addressed. He needs behavioral training with his keepers in order to have excellent compliance with some of the medical treatments that he needs to feel better.
So we have an incredible team on the husbandry side and the animal care health side that have put together a treatment plan for him where they're able to monitor him, use medical behavior training, have Makan choose to participate in medical care and health treatments to ensure that his health stays top-notch and that we can manage, monitor, and provide him a really good quality of life due to the care that he receives.
A lot of our limitations can be based around the types of tools that we have access to. There definitely are some tools and equipment that would make caring for these animals even better. Some of the tools that would really make our efforts facilitated include a utility cart. Oftentimes we've got bulky equipment that we need to take to an animal in order to treat them. One of the other tools that we really are in need of currently is a dental system. Although we do have a machine, it's very old and it only has one tool on it. We would really be grateful to get a full dental system with drills that are appropriate for extractions, scaling, polishing effort, and high-speed hand pieces that will allow us to do some of the tooth-saving procedures that might benefit the animal's well-being in the long run. We had an anesthesia machine. I think it was secondhand to us over 20 years ago. We kept it going for quite a while, but unfortunately it stopped functioning this year. And that piece of equipment was really important to allow us to seamlessly have our animal under anesthesia while we took radiograph. Right now, we are kind of using a workaround where we use our field anesthesia unit, which is not really the best equipment for an in-house anesthetic procedure. And we're using that temporarily until we're able to replace that anesthesia machine. And that anesthesia machine is also used for surgical procedures whenever those come up. Oftentimes we'll need to move into the surgery suite. It's got to be sterile in there. And so having that already in the surgical suite is an important aspect of managing some of our clinical cases.
By providing this high level of medical care for our animals here at the zoo, we ensure that these animals can thrive and that they can be part of a larger group of animals that we work with.
With your gift tonight, our animals will be able to live happier, healthier lives.
It's an incredible honor to take care of these animals and to steward this institution, and we look forward to many years in the future at this organization to help protect animals in the wild, to help serve our community, and to just be a wonderful resource for animals, conservation, the public, and everyone involved.